Today we'll deal about a topic of meningitis versus meningism, most often asked in vivas and during case presentations and all. So we'll deal this one. Meningitis is the direct actual inflammation. Direct inflammation of meningeal layers. Whereas meningism is due to the effect of some other systemic infection or inflammation. This will lead to meningeal irritation. So it is mainly meningeal irritation. And in both meningitis and meningism, there will be neck rigidity. If we check for neck nuchal rigidity, it is present in both. Neck rigidity present, here also it is there. But in meningitis, as it is due to the inflammation of the meningeal layers, there will be pain. So here, no pain, because it is not the direct inflammation of the meninges. And the other differences are convulsions, coma, or cranial nerve involvement. Cranial nerves involvement will be seen in meningitis. Here, no such involvements. And if we perform Kernick's test, that is flexion of the hip and knee to 90 degree, then passive extension of the knee, if we do, there will be lower back pain. So it will be very much prominent in case of meningitis, Kernick sign. Very prominent. Whereas in meningism, this Kernick sign will be either absent or poorly elicited. And in workup, if we consider CSF analysis in meningitis, often the fluid will be turbid, unless it is viral, where it will be usually clear, and there will be changes in the cell type and cell count, and some other biochemical changes can be seen, such as protein and glucose levels, and sometimes culture will be positive if it is actual meningitis. Whereas if we consider CSF analysis in meningism, so the CSF fluid will be clear always, and no changes in the composition of the CSF in terms of cell count, cell type, glucose or protein. No changes biochemically. And culture, obviously it will be negative. So these are the differences in evaluation of the neck rigidity. And where do you get meningism? Actually, why meningism will occur? As we told in the beginning, it is the effect of other systemic infections or inflammation. So what infections or inflammations will lead to meningism? To list few examples, we know about enteric fever, typhoid fever. So to name few, enteric fever and leptospiral Wheels disease. Again, one more type of, one more fever, Wheels disease can cause this. Respiratory system infections such as diphtheria, even some acute tonsillitis, and pneumonias, especially atypical pneumonia, or empyema thoracis, sometimes even leukemia and lymphomas can lead to neck stiffness, that is meningeal irritation, nothing but meningism. So these are the major differences we have to know when we are dealing with neck rigidity. Thank you so much.